Assembly, I have the honor to open the 77th World Health Assembly. We shall now move to agenda item 1.1, appointment of the Committee on Credentials. The Assembly is required to appoint a Committee on Credentials in accordance with Rule 24 of the Rules of Procedure of the Assembly. In conformity with this article, I propose for your approval the following 12 member states: Albania, Bhutan, Costa Rica, Guinea-Bissau, Haiti, the Islamic Republic of Iran, Kyrgyzstan, Madagascar, Mongolia, Uganda, Slovakia, Vanuatu. Is this proposal acceptable? As I see no comments, I declare the Committee on Credentials as proposed by me as appointed by the Assembly. Subject to the decision of the General Committee, the Committee on Credentials will hold its first meeting on Tuesday, the 28th of May at 2 p.m. 1400 in Building E, Room 23. Agenda item 1.2, election of the President. Let us now turn to the election of the President. In accordance with Rule 25 of the Rules of Procedure, at each regular session, the Health Assembly shall elect a President and 5 Vice Presidents who shall hold office until their successors are elected. In advance of the Health Assembly, a white paper was circulated containing the names of delegates proposed for consideration, following consultations in their respective regions, as well as in their respective countries. To consider the nomination for the office of President of the 77th World Health Assembly, I recall that in accordance with the practice of regional rotation, which the Assembly has followed for many years, the President of the 77th World Health Assembly should be chosen among delegates of members of the African region. I understand that it is proposed to nominate Dr. Edwin Dikoloty, Minister of Health and Wellness of Botswana, to the office of President of the 77th World Health Assembly. Is this proposal acceptable? In the absence of any objections, as it appears there are no other proposals, I suggest, in accordance with Rule 80 of the Rules of Procedure, that the Assembly approves the nomination and elects its President by acclamation.
Le docteur
Dr. Edwin Dikoloty, Minister of Health and Wellness of Botswana, is thereby elected President of the 77th World Health Assembly, and I invite him to take his seat on the rostrum.
Félicitations.
Congratulations, Dr. Dikoloty.
World Health Assembly, it brings together almost 200 countries with one clear goal: to promote health and well-being around the world. They all share a strong commitment to multilateralism and solidarity. In this endeavor, you can count on the European Union as a strong ally and a reliable partner. Dear friends, we all remember how the COVID-19 pandemic impacted our lives. It took a heavy toll on people, on our societies, and on our economies. It impacted each and every one of us. But we managed to overcome it. And this is thanks to the extraordinary efforts of health professionals, thanks to the resilience and solidarity of so many citizens, thanks to the outstanding research and development of life-saving vaccines, and thanks to the determined action and leadership at global level, including of this organization, the WHO. The European Union, too, has shown full commitment. In the past 5 years, we mobilized more funds and resources than ever before. We have taken immediate and concrete actions with the World Health Organization as our key partner. One of these actions is the ambitious Team Europe initiative for regional and local vaccine manufacturing hubs in Africa. We are now expanding to South America and Asia, and this is at the core of Europe's global health strategy, one of the main pillars of Europe's health union, and it is the right way forward. We all know that every crisis comes with opportunities. COVID-19 has given us a chance to reset our approach to public health, to come back stronger and more united, to be better prepared and more coordinated within and between countries and globally. The way we govern our global health architecture is an essential element of this. We therefore remain committed to concluding a pandemic agreement that makes a real difference on the ground. Ladies and gentlemen, preparedness goes far beyond the outbreak of a new pandemic. The challenges we face, regardless of where we live, are multiple. We face a climate crisis. We face the threat of antimicrobial resistance. We face a major global health workforce crisis. We have to build health systems that are robust and well-functioning. Only by working together will we succeed in bringing better health and well-being to people across the globe and create a safer and healthier world for future generations. Now is the moment to do this. I urge all of us to keep that in mind as we continue. And I wish you all good luck and success in your deliberations throughout this week. Let us be all for health, to deliver health for all. Thank you very much.
Thank you, Excellency. I have the honor to invite the Prime Minister of Malaysia, His Excellency, Mr. Anwar bin Ibrahim, for his remarks.
Excellencies, ladies and gentlemen, thank you, Dr. Ghebreyesus, Director General of WHO, for inviting me to address the 77th World Health Assembly in Geneva. I commend the inclusive theme of this assembly, All for Health, Health for All, which is aligned with Malaysia's national philosophy and values of civilizational development, centering on the core principles of sustainability, care and compassion, respect, innovation, prosperity, and trust. Underpinning the philosophy is the principle of social justice and equity, which includes the universal right to health. I am pleased to share that my government is fully committed to ensuring that every individual regardless of their background or socio-economic standing, has access to essential and quality healthcare services throughout their lifetime. Nonetheless, as we deliberate on the universal right to health,
together we can create a world where health is a universal right, where no one is left behind, and where every individual can thrive. Let us rise to this challenge with courage and conviction for the benefit of all humanity. Thank you.
Thank you, Excellency. It is my great pleasure to now invite the Director General of the World Health Organization, Dr. Tedros, to give his remarks.
Thank you, Mr. President. Your Excellency, Mohammed Ould Sheikh Al Ghazouani, President of Mauritania and Chairperson of the African Union, our guest of honor and the keynote speaker, Your Excellency Elisabeth Bome Schneider, Federal Counselor of the Swiss Federation, Honorable Dr. Edwin Di Colotti, President of the 77th World Health Assembly, President Thomas Bach, President of the International Olympic Committee, and I would also like to thank the leaders who have shared their messages via video, Secretary General Antonio Guterres, President Ursula von der Leyen, and Prime Minister Sreta Tavizin, and Prime Minister Anwar bin Ibrahim, Deputy Director General Mike Ryan, and our guest, Dr. Katalin Kariko, that will be the program latest Nobel laureate for mRNA vaccine. Very glad to have you here today. And the President of the International Paralympic Committee, Andrew, and recognition of Susie Rogers. And we have also Olympic champions, David Rudisha, Pau Gasol, and Mr. President and my brother Thomas, you're not alone. So you have a lot of Olympians here in the room. So very glad to have you, and very glad to have all these legends as well. Excellencies, ministers, ambassadors, heads of delegation, dear colleagues and friends. Good morning and welcome to this 77th World Health Assembly. Let me begin by offering my deepest condolences to the people and government of New Guinea for the many lives lost in Friday's landslide. WHO has offered support and stands ready to help in any way we can. And my thanks to Councillor Bome Schneider for Switzerland's continued support for WHO and your continued hospitality in hosting our headquarters here. My thanks also to Your Excellency, President El Ghazouani, for being with us today and for your commitment to health. I applaud your determination to achieve universal health coverage by establishing the National Insurance Solidarity Health Fund to provide cover for vulnerable people throughout the country, and your political commitment to integrate refugees from Mali into the health system in the southeast of Mauritania. I thank you also for your commitment, Mr. President, to co-host the first WHO investment round in your capacity as chair of the African Union, and we look forward to strengthening our partnership with the African Union during your tenure. We remain committed to supporting the Africa CDC and the African Medicines Agency. Thank you for your leadership, your example, and for honoring us with your participation and presence today. And my congratulations to you, Minister Dicolotti, on being elected President of this Health Assembly. My thanks to you, to President Bach, for your partnership. I think I don't want to go into details. You have said it all. I fully endorse all that he had said with regard to the partnership between WHO and IOC. Since we signed our MOU a few years ago, the partnership between the two organizations has grown really significantly. So thank you for your leadership, Thomas. And my thanks to Farah El Dibani for sharing with us the gift of your voice. And what a gift. Shukran Gazilan. She speaks, by the way, 6 languages. And it's amazing. And she sings in all of them. German, English, Spanish, French, Italian, I think, of course, Arabic. Excellencies, there are few gatherings like the World Health Assembly. Although we do this every year and we take it for granted, we must not lose sight of what this is and what it represents. The theme of this Health Assembly is All for Health and Health for All. This room right now embodies that theme. All for health, almost every nation of the world is represented here, along with dozens of partners. The UN, of which it is part, was born from the ashes of the Second World War. It was born of the recognition that the only alternative to global conflict was global cooperation. The WHO Constitution was and remains a visionary statement ahead of its time. It was the first instrument of international law to affirm that the highest attainable standard of health is a fundamental right for all people without distinction. Today, at least 140 countries recognize the right to health in their own constitutions. And yet, around the world, that right is often unrealized or under threat. At least 4.5 billion people, more than half of the world's population, are not fully covered by essential health services, and 2 billion people face financial hardship due to out-of-pocket health spending. Outbreaks, disasters, conflicts, and climate change are all causing death and disability, hunger, and psychological distress. The Constitution was also visionary in recognizing, in a world less connected than ours, that promoting and protecting health in any country benefits all countries. So cooperation is in the interest of each and every nation. It does it for its own sake. And it also recognized the reverse, that unequal development in promoting health and controlling diseases is a common danger. That's what the COVID-19 pandemic illustrated so brutally. And that's why you, the nations of the world, agreed 2.5 years ago to develop a legally binding agreement on pandemic prevention, preparedness, and response, and to strengthen the international health regulations. the task before you was immense, technically, legally, and politically. And you were operating on a very ambitious timeline. I thank all member states for the way you have engaged in this process over the past 2.5 years. You have demonstrated a clear commitment to reaching agreement. You have approached your task with determination and good faith. You have worked long days and nights. Imagine and closing your meetings 2 a.m., 3 a.m. The record was 4 a.m. If you didn't have commitment, you wouldn't do that. 4 a.m., sleepless nights. You have operated amid a torrent of mis and disinformation that was undermining your negotiation. You have come a very long way and found much common ground. And you have demonstrated that multilateralism is alive and well. Of course, we all wish that we had been able to reach a consensus on the agreement in time for this held assembly and cross the finish line. But I remain confident that you still will, because where there is a will, there is a way. I know that there remains among you a common will to get this done. So there must always be a way. It's now for this World Health Assembly to decide what that way is. Meaning, the solution is in your hands. And no one said multilateralism was easy. But there is no other way. The threat of future pandemics is just one threat among many. Our world is facing so many other challenges. Conflict and insecurity in Gaza, Haiti, Sudan, and Ukraine. Climate change, displacement, poverty, inequality, and polarization. Women dying from preventable complications of pregnancy and childbirth. Children dying because they miss out on vaccines. Outbreaks of cholera, dengue, and more. The increasing burden of non-communicable diseases and mental health conditions. I could go on and on. Even before the COVID-19 pandemic, the world was off track for the health-related targets in the Sustainable Development Goals. Now, we're even further behind. Between now and 2030, we must do all we can to get as far as we can towards the Sustainable Development Goals. This week, you will consider and hopefully adapt the 14th General Program of Work. Our collective strategy to accelerate progress towards the Sustainable Development Goals, enhance equity, and build resilience. It's not a plan for what the Secretariat will do. It's a plan for what we will do together as member states supported by the Secretariat and partners. GPW 14 incorporates lessons from the past, the realities of the present, and our aspirations for the future. It's anchored in our shared mission to promote, provide, and protect health. If we're to achieve that mission, WHO must be empowered and equipped. And I know you agree with me. That's what the first WHO investment round, which we launched last night, is about. And I would like to thank Prime Minister Mia Mottley of Barbados and former Prime Minister Gordon Brown of the United Kingdom for joining us last night and for their strong support for the investment round. Brazil confirmed that the investment round will be hosted through the G20, and Germany, France, and Norway confirmed that they will co-host. Thank you very much.
Once again, inspire people to move for health, getting millions of people around the globe to warm up for the Olympic Games and celebrate the joy of sport. This is why I invite also you to move, because sport keeps our mind and our body strong and healthy. In this spirit, I would like to thank in particular the Director General of WHO, my very dear friend, Dr. Tedros Ghebreyesus, for the kind invitation to address you, the 77th World Health Assembly. It is indeed a great honor to be with you here today. Our meeting allows me to express my appreciation to everyone at the World Health Organization for your guidance, reassurance, and support during the dark days of the pandemic. The pandemic made it crystal clear how important sport is for our physical and mental health. Sport can save lives. Obesity, cardiovascular predispositions, and other non-communicable diseases were the reasons for the vast majority of mortality during the pandemic. For all these diseases and predispositions, sport is an excellent tool for prevention. This is precisely what WHO and IOC addressed through our joint campaigns like Healthy Together or Let's Move, getting millions of people to stay strong and active when life, as we knew it, ground to halt. Countless athletes stepped up to the fight against the virus, joining the pro-vaccination campaigns, working in hospitals, helping and comforting people, encouraging to stay active and healthy, showing us that sport gives us hope. A highlight of these athletes' engagement was our digital Olympic workout, which in one single day introduced 500 million people around the globe to our joint campaign. We took our cooperation to a new level when it came to organizing 2 editions of Olympic Games during the pandemic. It is no exaggeration to say that without WHO, and in particular without our great friend Tedros, the Olympic Games Tokyo 2020 and the Olympic Winter Games Beijing 2022 would not have taken place in a safe way. Thanks to the comprehensive countermeasures and vaccination programs that we developed together with the WHO, we could make these Olympic Games safe for everyone and without a single recorded transmission from the participants to host communities. And this is why it's also a great pleasure to see here Professor Katalin Karikó, who was at the origin of the vaccine we could then all benefit from, and to thank her for this great contribution to humankind, but in particular to the Olympic Games. And I'm very happy to have learned this morning that it's not your only contribution to the Olympic movement, but that your daughter, as a double Olympic champion in rowing, is a great example of a healthy mind in a healthy body. In Tokyo and Beijing, the Olympic and Paralympic athletes amazed us with their response to all the challenges, showing all of us the best that humankind can be if we come together in peace, solidarity, and unity of purpose. This reaction of the athletes touched the hearts of billions of people around the world. If these Olympic Games would not have taken place, we would have lost an entire generation of athletes. This is why, in the name of all these Olympic athletes, and may I, under the supervision of my dear friend, the president of IPC, Andrew Parsons, also say the Paralympic athletes, I would like to thank you for standing by our side in these extremely difficult times. Since then, our partnership continues to go from strength to strength. We continue to make sport available as the low-cost, high-impact tool par excellence for public health. As part of this effort, IOC and WHO are pioneering new ways of cooperating at the grassroots level, bringing together the expertise of both local health authorities and sports organizations. Our aim is to facilitate access to community sport activities for over 1 million people. As part of this joint initiative, we are training coaches, teachers, and community health workers of 500 different organizations. We are doing so through innovative partnerships between the National Olympic Committees, local health authorities, and sports organizations at the community level. This is why I would like to encourage you, for not to say to urge you, to replicate this model of cooperation in your countries. Engage with your National Olympic Committee and your local sport organizations to integrate the low-cost, high-impact tool of sport in your healthcare and education systems. Looking further ahead, we see a great need for future cooperation with the WHO to promote the health of refugees. It was encouraging to see the WHO including health of refugees and migrants in your most recent global action plan. For the IOC, our work to support refugees through sport is led by our Olympic Refuge Foundation. The ambitious goal of the foundation is to give access to safe sport to 1 million young people affected by displacement by the end of this year. Probably the most emblematic symbol of our commitment to refugees is the IOC Refugee Olympic Team, which we created for the first time at the Olympic Games Rio 2016, and which will participate with a record number of refugee athletes at the forthcoming Olympic Games Paris 2024. Through this extensive refugee work, together with UNHCR, we are noticing that specialist organizations are realizing the importance of sport to address mental health issues. Just to give you one example, a recent independent study of our Sport for Mental Health program for refugees in Uganda showed that severe depression from participants who engaged in sport dropped from 57% at the beginning to just 6% at the completion of the program. The control group, which did not engage in sport, showed only a very, very modest drop in depression symptoms. Seeing this, we extend our hand to you, WHO, and public health authorities to work closely together for and with refugees. Your Excellencies, the theme of this World Health Assembly, All for Health, Health for All, is a timely call for collective action. Addressing global health challenges is a team effort. The world of sport is ready to be a part of this team to build healthy and resilient communities everywhere. Therefore, speaking under the control of my friend Tedros, for once I will dare, dear Tedros, to suggest a humble addition to your well-selected theme of today. All for health, health for all, sport for all. From our long-standing experience to put sport at the service of a society, we know that we have to bring the health benefits of sport to where the people are. This means at the grassroots level, in local communities everywhere. The Olympic Games Paris 2024 will demonstrate this in a spectacular way. A program introducing 30 minutes of daily exercise in primary schools throughout France is on track to reach more than 4 million children. Paris 2024 is promoting sport and physical activity in over 4,000 municipalities across France. All these efforts to bring sport to where the people are will culminate with the Marathon pour tous, the marathon for all, when over 40,000 people will run the same marathon route just hours before the Olympic athletes. But Paris is only the most visible aspect of our mission to make the world a better place through sport. Through our partnership with WHO, we are going to communities everywhere around the globe, bringing sport to all. We all share the same objective: all for health, health for all, sport for all. To build healthy and resilient communities, we have indeed to act faster, aim higher, be stronger, and we have to join hands. And in this spirit, I invite all of you to truly live this Olympic motto: higher, stronger, together. Thank you very much.
Director General Dr. Tedros, I would like to sincerely thank all our distinguished guests for their words of encouragement and well wishes. I am informed that the Director General would like to recognize the contribution of a few outstanding individuals for their exceptional endeavor and commitment to advancing global health. Dr. Tedros, you have the floor.
Back again. I hope you're not tired of me. Before I present today's guests to be awarded, I would like to, I think many of you have been there, but during the investment round, we have recognized, awarded Her Excellency Prime Minister Mia Mottley Lifetime Achievement. So she couldn't join us today, that's why we did it yesterday. And the people we celebrate today are part of that. So I would like you to recognize also Prime Minister Mottley's achievement. I have the honor of presenting the Director General's Award for Global Health to Professor Kathleen Carico and Professor Drew Weissman for their groundbreaking scientific work that led to the development of effective mRNA vaccine against COVID-19, research that led to them being awarded the Nobel Prize in Physiology or Medicine last year in 2023. Professor Weissman was not able to join us today, so Professor Carico will be accepting the awards on behalf of both of them. The vaccines that Professor Weissman and Professor Carico developed have saved millions of lives and prevented millions of cases of severe COVID-19. Their innovative joint work has played a critical role in significantly reducing the burden of mortality and the burden of disease of COVID-19. Their leadership in this field has the potential to play a critical role in major health breakthroughs in the future. This achievement results from decades of hard work, perseverance, unwavering dedication, and collaborative spirit long before this work was appreciated by the broad public and even the scientific community. Without their resilience and their relentless drive to advancing the science in this field, the impact of the pandemic would have been much, much worse. Professor Kathleen Carico and Professor Weissman, you have our thanks, our admiration, and our gratitude. And I'm pleased to present you with this award in recognition of your outstanding contribution to the health of the world's people. Professor Carico, I invite you to come forward to receive the award and say a few words. But since we have our guest of honor with us, the President of Mauritania and the Chairperson of the African Union, such a great honor to have him, His Excellency Mohammed Ould Sheikh Al Ghazani, I would prefer that the award was given to her from His Excellency the President. Please, Your Excellency, please join me.
Dear Excellencies, Ministers, Director General, distinguished guests, colleagues, I am deeply honored and grateful for being awarded, together with my colleague, Drew Weissman, by the WHO Lifetime Achievement Award. This award also recognizes the fellow scientists who worked diligently over decades to have built the foundation for our work that led to the development of COVID-19 mRNA vaccine. We did not invent mRNA. More frequently use the messenger RNA as mRNA. You are not scientists here, but this is a molecule that nature invented and carries the information from the DNA to the protein synthesis factory and tell it what to produce. The information from the DNA to the protein synthesis factory through the RNA is happening in all our own cells. Messenger RNA was discovered in 1961, and it took 60 years to develop the first approved vaccine as an mRNA in the form of COVID-19 mRNA vaccine. So what happened during those decades? Thanks to the hard work of thousands of scientists, the mRNA could code for any kind of protein, could be produced in a tube, could be delivered to the cells, and where it translated to a protein. However, the inflammatory nature of this mRNA prevented its medical use. Drew Weissman and I worked tirelessly to solve this problem. After years of experimenting and researching, we successfully could identify that one building block in the RNA is causing this unwanted effect. And we were successful to eliminate this, and we unlocked the potential of the nature. We accomplished this by building upon discoveries by thousands of scientists who came before us. And finally, we developed the optimal mRNA therapy. Our original goal as a scientist were different. I wanted to develop therapy for stroke. And Drew Weissman, he wanted to develop a best mRNA-based HIV vaccine. But ultimately, our work, together with contribution of thousands of scientists, culminated in the development of the vaccine. I have to say that you might not be aware, but by the end of 2019, so prior to the pandemic, it was already demonstrated in human clinical trial that nanoparticle containing modified RNA wrapped in the lipid already potent, it was a potent vaccine against avian flu and Zika. So even prior to the pandemic was shown. And this technology ultimately became basis for the two FDA-approved COVID-19 mRNA vaccine, developed by BioNTech, Pfizer, and Moderna, and to fight the pandemic and successfully protected millions of people from the serious effect of COVID-19. We recognize the importance of WHO to fight the pandemic, to coordinate resources, to provide plans and preparedness to prevent and respond to the next epidemic, and to assure better health for all of us. We are also grateful for the frontline healthcare workers for their heroic achievements. It is not lost upon us the incredible risk they were taking, willing to save patients, some giving the ultimate sacrifice to help others. They continue to inspire us to work harder and spring action to make life-saving vaccines. The possibilities for the mRNA technologies are endless. We have already exploring ways to prevent and treat diseases such as HIV, malaria, tuberculosis, influenza, respiratory syncytial virus, monkeypox, Epstein-Barr virus, herpes virus, Nipah virus, Borrelia, shingles, to eliminate cancer and to treat many other acute and genetic diseases with mRNA. This award is a wonderful recognition of the pioneering work of all basic scientists that fuel many technologies, advances, and open the door future therapeutics. Thank you very much.
We greatly appreciate your support. Do share your thought in comment section.